start out, I just want you guys to do a brief introduction. Tell me about your level 2 sites and your capstone projects, and then maybe a little bit about you being a mom. So Veronica, why don't we start with you?
Hi, my name is Veronica Anduha, and I'm a third-year Doctor of Occupational Therapy student at Torrey University, Nevada. My two level 2 placements were varied. One was in acute hospital at St. Rose Dominican Health Hospital, and then I was also placed at a pediatric outpatient clinic at Thrive Therapies, and that one was my most recent one that I just finished this past fall. As I look ahead to my capstone program that's beginning in March, it will be a conservative, healthy pregnancy and anti and postpartum pain prevention program. Um, the aim of the program is to increase the advocacy, education, and to reduce the pain of that population as they go through the transition of pregnancy.
Thank you. And then, you're a mom, right? So tell me about that.
I am a mom. I have a daughter. She's 9 years old. She's going to school daily, which has been a big change. Of course, like every other mom, first going to quarantine, but because of the school that she's in, they reopened this year in July, and so she has been going to school on a daily basis. So it's still a struggle, and what a change it was going from quarantine and being schooled at home to going back to school. So we're still on a growth curve since that time because of all the changes, not only from just learning to rebalance her life socially in class with her friends and peers, but also learning to kind of understand that she still can't be as close to them as she wants to be. They have constant reminders to the kids about the rules of the school and proximity to one another. And so even though she is back in school, it's still a challenge because she's not really getting that full interaction with her peers that, she misses. And so it has been hard.
Yeah. It's interesting to see the different phases of motherhood right now, because I have friends who are just having their first child, friends who have, middle age, whatever, the whole thing. And it seems like there's super big challenges no matter how old the kids are. But yeah. All right. Well, thank you. Okay, Justina, how about you?
So my name's Justina Selim, a third-year occupational therapy doctorate student as well. For my level 2s, I was at a hand therapy clinic for one of them, and then I was also at an inpatient rehabilitation hospital. So we saw parents in both of those settings. And then for my capstone, I'm working at the Cleveland Clinic, doing a health and wellness program for parents with multiple sclerosis. And we're just kind of focusing on, the issues that they face and just combining the roles of parenthood and then also managing the symptoms of their chronic illness. So I have 3 kids. I'm a mother also. Their ages are 14, 12, and 8. Unlike Veronica, my kids are doing school at home. So we're all here. It's been interesting, but I think we're surviving. So.
So just a little bit about me. I, for my level 2s, were at, I'm trying to think, advanced healthcare, which is a subacute setting. And then my other one was at Tilton's Therapy for Tots, and that was a mobile outpatient for the pediatric population, which was great. I didn't know how I'd feel about it, but I absolutely loved it. And my capstone project, which you all are participating in, so thank you very much, but it is about preventing postpartum post-traumatic stress disorder for new moms that are just giving birth. And I will be at Centennial Hills Hospital in Las Vegas for that. Just a little bit about me being a mom. I'm a mom too. Woohoo, moms. I have 4 kiddos, and my oldest is 14 and my youngest is 6. And that really is what started my interest in this area, is giving birth 4 times, seeing kind of the variety of ways and interactions and how things turn out, and some were better than others. On my 3rd pregnancy, I actually had a traumatic birthing experience. My daughter, it was a difficult labor and delivery, and I had too much amniotic fluid. So I had back pain, and it took forever. And when I actually got to pushing, about halfway through, the doctor got really serious and kind of shouted at me some orders. He was a former military guy, and he says, "Okay, you have to push out now." And I wasn't having contraction. He said, "She's in distress, push now." So pushed her out, and she was born blue, and she wasn't breathing, and she didn't breathe for a good minute or so. And that was probably one of the scariest minutes of my life. And it was just interesting to see that there was no discussion about what that was like for me. It was just kind of like, all right, this horrible thing that almost happened and didn't, and now you're scared and you don't feel safe and all of these things, and just move on. Nobody talks to you. You go home with this baby, and there you are. And then 13 months after that, my sister had a traumatic birth that I was present for, and the crash cart was called for both her and her son. It was pretty touch and go there. So I saw her go through the same things as me. And I mean, it took me years to be able to talk about it without bawling my eyes out from my experience. And my sister is still there. And that was 8 years ago. She still can't talk about it. So I see that there's this real need for a mental health focus with moms. And I think there's a lot of things that OTs can bring to the table when it comes to helping new mothers. And it's really unfortunate that there really aren't OTs in maternity care units. There might be some isolated scenarios where that happens, but for mainstream healthcare, that doesn't happen. And that's something that I feel like we need to change. So let's go ahead and dive in. In preparation of my capstone project for my third year, I had some different questionnaires that I sent out. I sent out questionnaires to occupational therapists and some special interest groups on Facebook, and then also some occupational therapists that I know personally. And then I sent out some questionnaires for mothers in mothers special interest groups on Facebook, as well as mothers that I know personally. And then also, I only got one maternity care nurse to answer my questionnaire, but I did do that. And then I did an interview of a NICU occupational therapist at my site. So based off of those results, we're going to talk about them. I asked mothers what they dealt with, what was the most challenging part of giving birth, and what they didn't get help with that they felt like they needed help with. And then I asked occupational therapists, what do you think that occupational therapists have to offer in that setting? So just starting off, before we dive too much into that, why don't we talk about where OTs are as far as treating women that are pregnant or newly delivered. So we just talked about they're not in maternity care units, but where might we see them? So Justina, you were in a hand clinic. Tell me about that. What do you know about repetitive use injuries with hands or upper extremities and how that might impact new moms?
Yeah, so I didn't see a ton while I was there, but we did see some. So, just the repetitive movements required for lifting up your baby, for breastfeeding your baby, even for things like, preparing bottles the same way every time, just things you do over and over and over again can lead to just a variety of different repetitive use type injuries. And it was different for everyone. Like there was moms with de Quervain's a bit. I think we had one or two of those, and carpal tunnel syndrome. So we definitely saw it there quite a bit. Yeah. Did I answer your question? You're muted.
Yes, you did absolutely answer my question. And I don't know if you saw any women when you were at Health or at Encompass. Did you see any women that were of childbearing ages that had recently given birth or had young babies or maybe even pregnant?
So with my experiences at Encompass, most of the women were older and had, children at home. So there was one lady in particular that kind of stood out. Her youngest daughter was 30, but had some disabilities that made it to where she still lived at home. And she was really worried about how she was going to go home and still take care of her daughter. And there was also a mother who I think her kids were like high school age, like about to graduate, but she had lost custody of her children because she just couldn't figure out how to manage the symptoms of her disability and take care of her children. So that was really heartbreaking to me. And And she had MS, and that's honestly what kind of inspired me to work with parents with MS, because I feel like if she would have had support and guidance early on, that she, maybe she could have figured some strategies out. So not a ton of mothers there at Encompass. It was mostly older moms, but still, had experiences that were troubling.
Absolutely. Okay, thank you. How about you, Veronica? In your experience, did you see mothers?
When I was in the acute setting at St. Rose, I did not come across any moms that were in the antepartum phase of pregnancy or within a year postpartum. However, when I was in the outpatient pediatric clinic, I did come across moms that were, I would say, within 1 to 3 years, or even from birth to 3 years postpartum. And so, one of the things, of course, that was coming up was the injury and fatigue, and talking to the moms, finding out what was their problem. Sometimes, as we were treating um, their child for their disability, uh, moms would share as they opened up to us that they were having pain in their shoulder, in their neck. And so we would talk to them about strategies they could do, icing, heat, depending on the situation and the individual, and oftentimes just reviewing their ergonomics, like how are they holding the baby, what are they doing, and how severe is it? Is it to the point where they can't even lift the baby carrier? And figuring out what kind of modifications or adaptations we can make to their habits and routines to help them, be able to do what they love to do, which is being a mom. And for a lot of them, um, unfortunately, they were single moms, and so they were carrying the full burden upon them, and that overuse, like you said, was occurring because they were by themselves.
Absolutely. So obviously for me in subacute, I think the average age of my patients were about 80, maybe 75. So not a lot of moms there, no moms there. I mean, a lot of moms there, just older mothers, grandmothers, great grandmothers. But when I was in outpatient peds, I was in the home. So I saw families in every stage that you could imagine. I had children on my caseload who were really adolescents, 17 years old. And then I had little ones that were just about a year old or just under a year old. And I was originally going to be with early intervention, which would have been an even younger population. But in any of those kinds of settings, you do see mothers. And something that I noticed when I was in outpatient peds is that mothers had some really challenging mental health issues going on, especially because I went during a unique time during COVID. So they were dealing with closures and being home with the kids all day. Most of the mothers that I worked with were military moms. So dads were deployed, dads worked shift work, dads just weren't able to help out as much. And that was a huge part of our intervention, was trying to help mothers and their mental health. Because really, when you help mom, you're also helping baby and child. And there are a lot of challenges that just aren't being addressed. So let's dive in. In my survey for mothers, there were 232 mothers that participated. And in addressing the most difficult challenges during the maternal period, here were the top 10 reported difficulties. So I'm going to list them in order from most cited to least cited. And then after we do that, we can start chatting. So the first one was body changes. Mothers did not feel like they got adequate support with their body changes. And you think about it, my weight gain changed from, one of them was 30, at most two were 30, one was 50, and one was 60 pounds. That is a lot of change, and you were waddling around. So what do you guys, how about you? When you guys were pregnant, did you have like some real difficulties with body changes?
Definitely. And with each pregnancy, I gained a little more weight than the previous pregnancy, and I can actually remember asking my doctor, like, I'm gaining a little more weight than I had hoped. Do you have any strategies for me? And the only thing he said was, when you sit down to eat ice cream, don't eat the whole carton. Just take a few bites. Like, okay. And so I really felt like, how do I figure this out? I just wanted some realistic strategies, but it's hard to find.
How about you, Veronica?
For myself, I had a C-section with my daughter, and so immediately after, um, it was just, I'd say within a week after, I just completely swelled up and couldn't find my ankles. And then all of a sudden, all of that water that I was retaining was gone. So I had a huge change in stability and balance. And I still remember I was furniture walking for a little bit of time, through the healing process, and then learning to recalibrate my own ability to balance myself as I went around my daily routine.
Absolutely. I know that with my second pregnancy, I started to, during my pregnancy, get lower back pain. And then that lower back pain just got worse after I had my daughter and was carrying her everywhere. And trying to get a referral even to physical therapy. I didn't even know about occupational therapy at the time, but trying to get some kind of referral I had to go through so many hoops. And then it just got worse. Each pregnancy, my lower back pain got worse and worse and worse. And it wasn't until I went through OT school and realized that I had lordotic posture, and I had, that exaggerated curve in my lower back, which was causing my problems, that I was able to start fixing it. And so I really worked on, my positioning of my pelvis, and I have gone now probably a good year without lower back pain. So there are a lot of things that just aren't addressed, that are very common with moms that we really need to start addressing. All right, so number 2 on this list, intimacy changes with partner. Now we don't have to get too personal. It's up to you, but I mean, I noticed that too. When your body's changing like that, it's not just your stomach that all of a sudden is in the way and making you uncomfortable. You also have different types of responses. Your physiology of your body is changing. The way organs inside of your body are moving around. And so things that maybe gave you sexual pleasure before no longer give you sexual pleasure. And you really have to work through it. And then you also have problems with pain. So how are you going to position yourself? And that absolutely changes during pregnancy. Do you ladies have anything you'd like to add?
I think post-pregnancy too, one thing that was hard for me is, getting used to the way I looked in that transition phase where, it's maybe hard to lose the weight because I'm breastfeeding or whatever reason. But also, breastfeeding a baby, it's like at least every 2 hours, you're having someone on you, and then at the end of the day, you've been clobbered by children all day. And then it's like, oh, I'm home. And you're like, I don't want to be touched anymore. So even just like the sensory overload just made me, just not want to be touched.
That's a great point. I haven't thought about it that way, but I actually remember during that period telling my husband, telling my kids, stop touching me. I don't want to be touched anymore. And I always felt so horrible because I'm thinking, I'm a bad mom, I'm a bad wife, but you really do have sensory needs as an individual that do need to be met. And so occupational therapists have those sensory strategies that can help a new mom deal with those feelings. How about you, Veronica? Any ideas?
I think for me, I just did not want to be touched. We had struggled to get pregnant. I had a history of endometriosis and fibroids, multiple abdominal operations to, treat that disease. And I was so concerned because of previous miscarriage that I didn't want anything to impact it. So I kind of tossed the cold water on him and said, you shall not pass. this is now my body and you're not touching me for a year. Get used to it.
Well, and it's interesting to see because with my first pregnancy, I really missed intimacy. And so waiting 6 weeks was really actually hard for me because I missed feeling close to my spouse. I felt lonely. I felt unloved. I felt ugly. I felt all of those icky things. And so that was hard. So I can see mothers on the other end, waiting those 4 to 6 weeks and just having that negatively impact them as well. And then fast forward to my last pregnancy, I had my son in a birthing center. It was also a surgical suite, so it was a lot more medicalized than most birthing centers. And my midwife, when I went up for my check, I went early because I moved when my son was 3 weeks old. So I went at about 3 weeks, and she said, "Well, have you tried to have sex yet?" I I thought, no, not interested. Thank you very much. And it was months before I was at all interested, because it's traumatic. I think for some women, it is a very traumatic process. And so the idea of going anywhere near that area is very frightening. I think the difference too with that pregnancy versus some of my others is when I gave birth, I did it naturally. So, didn't have the medical interventions, not the epidural, things like that. So I felt every ounce of pain and every ounce of trauma that there was. And I really think that was part of what freaked me out so much. I also remember with my first kiddo, nobody prepared me for this. But I think one of the first couple of times I was intimate with my partner, I had let down in my breast, which was so horrifying to me, that here I'm having this experience that's fun and exciting for me, and my body betrays me. And I'm like, it's like my baby juice is coming out. I'm like, that's the last thing I want to think about right now. And I was so embarrassed. I was horrified. And it wasn't anything that my partner did or said. It was just me. I was horrified. So I think that's something too that, moms aren't really prepared for. They don't know that before they give birth. And that's something that we could actually play a big part in. So speaking of which, let's move on to breastfeeding. That was number 3 in our top 10 reported difficulties. So breastfeeding. When I first had my first child, my mom was there. And as soon as the baby came out, my mom was putting baby up to my breast, grabbing my breast and putting it in my baby's mouth. And I was not prepared or ready for that. I don't know what I was thinking. I guess I thought that it would just happen naturally. And it might have had nursing staff put the baby on my abdomen, skin to skin, because there is this process where babies within the first hour and a half of their life, if you do that, tend to crawl up the mother's abdomen to the breast and breastfeed naturally. But that is not very common. It has gotten to be more common where nursing staff will put baby on mom's belly, for a little while, maybe 15 minutes, but rarely does it last the whole hour and a half. So tell me, ladies, how was breastfeeding for you, and what kind of challenges do you see or did you experience?
Breastfeeding for me was awful. Like thinking back to like what was the hardest part about having a baby, breastfeeding was my number one difficulty. And I knew I was nervous about it. And so I took classes before, learned everything that I could. I knew all the positions like that you could breastfeed in before my baby was even born. But it was so painful. Like within days, I developed like cracks and sores that just would not heal. And I feel like the resources I needed, I just couldn't find them. Like I was asking everyone, and I went to La Leche League and, sat there, and as a young mom, like I was horrified to like sit in this chair in this random office while a woman watched me breastfeed. I was so embarrassed, but I was like, I'm willing to do anything to just figure this out. And I was like bleeding while I was breastfeeding. And I mean, it was just really hard. And so ultimately I ended up I would breastfeed once a day, and I would pump all the other times and give my baby a bottle. But I also had this thing in my mind that like, if I didn't breastfeed, I was a failure, And so I was just determined to do it no matter the cost. But looking back, it's still traumatic.
Yes, and this body part of yours that is such a sensitive area, and that probably up until that point has been used for sexual pleasure, is now being used to feed a baby, keep a human life alive. And it can feel just like your body doesn't belong to you anymore.
Yeah. And I really feel like if like thinking back, like what would have made me been a little more successful or, been helpful. Like if somebody could have come to my house and given me like the support and training with my own pillows, with my own furniture, in my bed, like all the places that I'm actually breastfeeding, it would have been, I feel like, a lot more helpful.
It's so funny that you say that, Justina, because I had a similar experience. And, I told you I had a C-section. They immediately put baby on me. And I was like, wait, I just felt like no preparation. All of a sudden there was just a baby on me, after I had been cleared and wheeled to the second room where she was given to me, and I just kind of didn't feel connected. I was like, is it going well? How do I know that baby is latching correctly? And like you, within 2 to 3 days, I was a mess. And I remember one nurse coming in and saying, "Oh, she's just doing a quick examination." She goes, oh my gosh, nobody gave you a pump. And she ran out the door, like talking to herself. She was so upset because um, of the state I was in. And I was there for 5 days following delivery for recovery. And when I got home, it was just a mess. I think I was crying every day because I didn't feel successful. And fortunately for us, we had a friend who was a lactation expert. And I just remember the door opening and the light was behind her. And it was that moment. And I just was a ball of tears. And she had to do deep tissue massage, educated me on the helpful um, strategies like a warm shower and how we can use those things to stimulate our breast milk, and telling me about other supplements that we can also use to help us. And I think that was something that was missing. And Elle, like what you said, for me, breastfeeding, I mean, that just shut down my whole body. So it was really hard on my relationship with my husband because he was so excited to have that closeness back again and to reconnect with me. And I would just put my baby on my breast and I would just be like, oh no, because that was like, it just shut my body down. It was almost the opposite of where I needed to be mentally to be able to reconnect with my husband in that kind of a sexual way. So that was my experience.
Yeah. And I think that hospitals have gotten better about supporting moms in breastfeeding, just from my experience to my first one to my last. And I also understand nursing staff is busy and they really are focused on trying to keep mom and baby both stable. So they have a different set of priorities than someone like an occupational therapist. And so I think that it would be very helpful to have somebody who is there, and that is what they're devoted to do, is to help mom come up with these strategies and routines. I think that's a big part of breastfeeding too, is routine for being successful when they go home. And that is something I think I look back at breastfeeding and I'm like, my first one, I had no idea. I felt like the baby was attached 24/7 and I had no strategies to keep a routine going. And I think that's where a lot of depression came from. I had postpartum depression with my first daughter, and a lot of it was winter, it was flu season. We couldn't go anywhere. I had been working up until I delivered. I had planned on going back to work and chose not to. For various reasons. And I felt so alone. And I think a lot of it is having this baby on my breast 24/7, not being able to do the things that matter to me. And just because you have a baby doesn't mean that your needs as a human being go away. And that's something that occupational therapists are really wise at, is having an occupational balance and how to promote that in our lives. So speaking of loneliness, that's our number 4 is loneliness. Mothers said that number 4 of their top 10 reported difficulties was loneliness. Did you two experience loneliness after you gave birth?
Go ahead, Veronica.
I was just going to say, for myself, after I gave birth to my daughter and I received clearance about a month later, we actually moved from where we were living in California to go back to our home, which is in Hawaii. And so that was a hard transition looking back, because that support circle that I had built over time was suddenly taken from me. And I did, have a new support system, which was my previous support system of my family and friends from my hometown. But it was hard for me because those friends, um, I think those families that had children like me, or they were about the same age as me, when I got home, I didn't have that. So having that connection to someone who is going through the same thing as you was missing. And I think that was an important part. And looking back, now, of course, we're so great about getting on Zoom or FaceTiming. Had I been in a better place where I could have accessed that, I think that would have really helped my transition there and helped me to feel a little bit less alone. even though I was surrounded by family at the time. And I think, right now, that's like a huge problem. We have, almost segregated women that are pregnant and women in postpartum phase because we're trying to protect them from getting COVID and protect them from possibly passing that on to a newborn child. And that's really affecting, I think, our community.
I agree.
I also was pretty lonely after having a baby. I mean, a lot of the things, right after you have a baby just require you to be home. They nap a lot, they need a schedule, they need a routine. And so you change what you like to do and just take care of the baby and fulfill the baby's needs. And you find yourself alone quite a bit, But also, I think is just a cultural thing for me. Like that was expected of me. It was expected that I give up most of my interests and hobbies when I have a baby and do whatever needs to be done to keep baby happy and family together, And so I think it just naturally leads to loneliness unless you actively, make it a priority to maintain your interests and hobbies, which I didn't figure out until my kids were much older.
Me too. Me too. I feel the same exact way. And kind of tying that into breastfeeding as well. I remember my second child, she hated breastfeeding. And I felt that pressure to mothers, should breastfeed, even though it was not working at all. And it got so bad because she would fight me whenever I tried to breastfeed her. She would cry and scream and kick, and like she wouldn't do it. And when you're breastfeeding every couple of hours, it makes it really hard to have relationships with other people or do those things that you like to do. I remember when she was 4 months old, we were in Midway Airport, I believe, and it's in Chicago. And my daughter, I had a blanket over breastfeeding because I was very uncomfortable with open breastfeeding at that point. I'm not anymore, totally open, don't mind at all. Now that I'm not even breastfeeding anymore. But yeah, at the time I was really shy. I didn't want anyone to see my breast. I didn't want to be indiscreet. So I had a blanket over and my daughter was screaming and thrashing and pulling the blanket off. And I thought, everyone was staring at me. And I just thought, oh my gosh, this is horrifying. I'm a horrible mom. I'm a failure. And I went home and I stopped nursing. I just like, all right, you get a bottle. I'm done. And once I did that, our lives got so much better. And that's not to say that everyone should bottle feed their baby with formula, but that is what was best for us and our family in that situation. And once I did that, I was able to start having outings and not be horrified of what was going to happen or scared. So I think that's something to think about too, is getting to the bottom of why aren't moms engaging in their valued occupations? So why aren't they getting enough sleep? Why aren't they being social? Why aren't they having leisure activities? All of those different things that matter to us. Okay, so go ahead.
I'm sorry. I was just going to say that's such an important point because it reminded me that when I went to, I think it's the 2-week checkup at my daughter's pediatrician, I had the planner with every feeding and the diapers, and I had it all in a list, how much she had, and it was immaculate. And I remember my mom and dad came because they were the proud grandparents, and then I had my husband and baby, and the doctor was like, "Oh, this is great. What's your phone number?" And I remember looking at her and I was like, 492. And then my voice just kind of trailed off and I was staring into the heavens trying to figure out what my phone number was. And I did not know it. And all the numbers I gave her were not in my phone number. And I didn't pass her cognition test because I wasn't getting any sleep. And I was trying to be super mom because, like you said, Justina, that was what was expected. And those were my goals. And I didn't realize I had sacrificed my own ability to sleep and to heal after having a C-section. And so they basically took away a feeding for me in the day and at night so I could get a full 4 hours sleep. And that's just something I had to sacrifice. And it was the opposite of what my goal was, but it was what I needed to do to take care of me.
I think for me personally, part of my feelings of I have to do this myself and I can't ask for help is because I felt guilty for being at home. Because I had been working before and then I wasn't. And then I mean, after my first child, I usually worked part-time just because I needed it for my occupational balance, and money helps too. But I remember feeling so guilty asking people for help, or my husband, because I'm like, they're busy, they have jobs, they have things they're doing. This is my job. I need to do it 24/7. The problem with that, of course, is you need breaks, and so when dad's at work and you're at home, you're both working. And then when you're both home at the end of the day, maybe look to split those duties. And it wasn't until later when I just got to, the end of my rope and I was like, I can't do this anymore. You've got to help me. I can't do it. And then I started to accept help and even ask family for help because I'm one of those proud super mom types. I'm like, I'm going to do it myself. So absolutely. And I think that gets into number 5, changes in identity. So, when you're changing from something like, okay, I'm a teacher, and then now that's gone. Well, what's left? Well, I guess I'm just a mom. And I don't say that in a negative light, because being a mom and being a stay-at-home mom is the hardest job I've ever had. But I do mean that your sense of self changes. Did either one of you experience that kind of crisis of identity after giving birth?
I don't know if I had a crisis of identity, but I do think I muted my self needs to the point where I started to have bilateral or both shoulders freeze up. And I didn't tell anyone. Like you mentioned earlier, Justina, you just kind of like hush yourself and you're just pushing through. And I remember it was, baby was older and I had passed her to daddy, and daddy had her and he was, drying her off, and I had hopped into the shower and jumped out, and he was watching me put on my clothes, and he was like, "What are you doing?" And I had my arm and I was pulling down my shirt to slip it over my elbow. And I'm like, I'm trying to put on my shirt. He's like, but why are you doing it like that? And I finally told him I'm having pain in my shoulders. Well, it was to the point that I couldn't even lift my arm past this, both sides. And it was so bad. And my husband, being a physical therapy assistant at that time, was just through the roof. He couldn't believe I had let it go to that point and that I'd never said anything. And I was having such a severe pain, but I was breastfeeding. I didn't want to take medication because I didn't want to stop breastfeeding, as we talked about earlier. And so I was just suffering through and not saying anything. And so he started me on a therapy program, and, I gained my flexibility back and everything. But um, at that time, I was just hushing myself because I was trying to fulfill my duties as a mom.
So maybe feeling like that mom identity took over your sense of self, like you matter too. You need to have your pain assessed and addressed, and it's not just the baby that matters. Is that that's what I hear you saying? Yeah.
Yeah.
Okay. How about you, Justina?
So for me, I definitely, like, as soon as I had the baby, I let all of my other roles go. Like, the role of mother was the only one that mattered. And I think it was like a cultural thing. That was what was expected. But I also was able to, I don't know if it's like convince myself or whatever that's what I wanted as well. And I was able, so I don't think the crisis came until I had been doing it for about 10 years. And then I think the crisis was like, whoa, wait, 10 years just went by and this is all I do. I'm mother and that's it. And but I don't think, I think I embraced it and I was fine with it for quite a while. But I didn't realize how much it was affecting me until quite a lot of time had gone by. So whenever I talk to like younger moms, I'm always like, don't give up your other roles. Don't give up your other hobbies, because it's very hard to, get back into them once you let them go. But the last 5 or so years have been really focused on finding myself again and incorporating new hobbies and, going back to the things that I used to do and trying to figure out how to do them again.
Absolutely. I remember too, deciding to be a stay-at-home mom. I was trying to think, when I had a 4-year-old, a 2-year-old, and a brand new baby, I realized that I was in a bad way with my identity. I remember being scared to speak to adults because I only spoke to children, like toddlers speak, like that's all I saw all day long because my husband worked full time and went to school full time. So I was alone. I was like a single mom. And it just got so weird. Like I would be afraid to go talk to adults. I was an adult, I'm like, am I adult? Yeah, I'm an adult. I'm not a toddler. And I was so scared of, starting a job or going to school or putting myself out there because my self-efficacy had gone way down. My belief in myself that I was more than a mom had really kind of disappeared. And I do think that's common, speaking to you ladies and to some other people that I've spoken to. And that's something that occupational therapists can help with. A lot of it is by, again, engaging in those occupations, but it's also trying to explore not just occupations you've had in the past, but new things, because, your life is different. You do have these children or child that needs you, and you have to do things a little bit differently. And so that's something that I think that we could really help with. On to number 6, having to return to work too soon. Did either one of you ladies go to work after you had your child?
I did. I would say my daughter was about 2 or 3 months when I went back to work. And looking back, I wish that I'd had more time just to be mom and bond. But I was in a unique situation, so I was very lucky. My dad was her caretaker. And so when I was having my bad days, he would just drive her over to me and I would breastfeed her while I was working and then get my snuggle time and vice versa. If she was having a rough day, he would just drive her over to me and I could, put her to sleep or feed her and cuddle. And those were happy moments. And um, really, it shortened the whole day where I would just be gone for like maybe 3 or 4 hour chunks and then I would be right back with her. So it was really a blessing. And I know that that's not something everybody gets an opportunity for.
Absolutely. How about you, Justina?
I worked a little bit when my third child went to kindergarten. I started substitute teaching, but it was pretty easy to manage because I would just, I was gone the school day just like they were, and I would substitute for my children's classrooms too, and it wasn't as fun. They were so naughty when I was the teacher. But I know my sister, she went to work pretty quickly after having both of her kids because she's a nurse practitioner and has to work to keep her license current. And she really struggled with, just the guilt of leaving and the finding appropriate childcare was hard, someone you trust. And the breastfeeding thing, like those are her biggest complaints, were figuring out, where to pump and the acceptability of pumping. It would annoy some people. Some people thought it was great. And then having to keep the milk at a certain temperature while she finished out her day. And then also just even lugging this huge industrial size pumping thing, like pump to work, because if you use the cheap pumps, it takes an hour. So she needs to bring this huge, really nice pump, and it drove her crazy. I mean, it's still managing her work with her because she works full time still with 2 kids, and it's really hard.
So with the rest of my children, I didn't work right away after I had them. I eventually went back and would work part-time or things like that. But with my third daughter, I went back 8 weeks after, and I was teaching. And I remember to this day, I was teaching high school English, and I was so engorged, like 2 hours in, and I had to wait till lunch till I could pump because my prep was the end of the day. And I started to leak while I was teaching in the middle of class. And so I have, this stuff coming out. I'm just like, oh my gosh, these high schoolers are watching. I was so mortified, and I was like crying. Like I would teach for like 5 minutes and then give them an assignment, and I just go sit at the desk and cry. It was so traumatizing for me. Honestly, it was really, really soon, and I wasn't ready. And looking back, I think something that would have helped me is having a transition plan in place. that's something that occupational therapists do, is we are experts in transition plans. And so that's coming up with what do we anticipate happening? What are our plans to address those things and those challenges that happen? How can we get support, the support we need? You know, maybe I could have asked, hey, can you change my prep so it's in the morning rather than the afternoon? Can I have X, Y, or Z? Can I maybe, you know, just there's different things that I didn't work through that would have been good to work through before I jumped right into that. And it would have helped my mental health a lot, because it was a difficult transition for me.
That's so true, Elle. I think that's a missing piece. Not every woman knows that there are laws established to give us that right. We have the right to a locked room at our jobs so that we can pump. And we have that right to go when we need to go. You know, we shouldn't postpone our own needs just to meet someone else's needs. As long as we're communicating with them, we're upfront about our needs, and we let them know we have that right to excuse ourselves and go take care of our physical needs.
Absolutely. And it is a medical condition. It is something that is protected. And I was fortunate. I had a locked classroom. I did have some people who had, you know, skeleton keys, the master key, walk in a few times while I was pumping, and that was fun. I didn't mind, but I think they were horrified. So yeah, there's a lot of things, you know, transition planning, again, maybe I should have made a sign on the outside of the door, breastfeeding, come back later, you know, that those things you don't think about. All right, now on to number 7, relationship changes. And we've kind of alluded to this a little bit as we've talked, some difficulties that we had with our partners. My partner, I think, would have been very understanding, especially early on, if I communicated with him properly. But I just didn't even feel like I had the words to communicate what I was experiencing, because I wasn't prepped. I didn't have that transition plan. I didn't really know what I was getting into. And I thought, you know, no, I'm tough. I'm different. I'm a different type of woman. I can do anything. And then I realized pretty soon, like, no, I'm in over my head, and I don't have the language to communicate my needs with my partner. And I would just get upset. I wouldn't say anything. He wouldn't understand. I'd just be mad all of a sudden, and I would be mad for the rest of the night. You know, because it's something so silly, like the baby was fussing and I wanted him to pick the baby up, but he didn't. So I did, and I was mad, you know. But rather than saying, hey, will you please pick baby up? I've got stuff I've got to do. I need a break. I wouldn't do that. And so I saw that change with my partner. How about you, ladies?
Similar things, you know, a new baby, there's a lot of new responsibilities, a lot of new chores that need to be done. And for me, being the stay-at-home mom, you know, most of those duties were mine. And so I think the division of work is really hard. And like you said, the only way to really work that out is like clear communication of, you know, these are my responsibilities, these are your responsibilities. And the other thing is, with my husband, he's a great father. He feels more comfortable interacting with older children. Like it's really nerve-wracking for him to even hold a baby. You know, it doesn't feel natural to him. Or, I mean, he got better as our kids got, you know, with each kid. You know, I've done this before. I know what I'm doing, and we just had different childhoods too. I was the oldest child. He was the youngest child. So I was used to changing diapers, holding babies, you know, doing dishes with a baby or whatever. And he just never had those experiences growing up. So we definitely clashed. But I think if you know, figure out the language to use and the conversations that need to happen, it can be managed. But you need to have those conversations and the coping strategies that will make it work.
I agree. How about you, Veronica? Was it a smooth transition?
You know, it was interesting. I think because the pediatrician stepped in and assessed me, and I lost those extra feeding slots. I think there was an immediate change among my family where they just naturally pitched in, and it's probably cultural norms and what's accepted and what's not in our family system. But they took over everything. Like, I didn't have to cook. I didn't have to clean, because they were like, you just need to rest. And I think it's because the pediatrician took my whole family aside, because remember, it was my mom, my dad, and my husband, and said, look, she she cannot do anything else right now. She needs to just heal. She's had a major surgery, and she's trying to be a new mom. And so whatever she said to them while I was in my delirium, uh, she made an impact. And so they really stepped in and took over all of those needs that would sustain our family. And I was just allowed to be mom, take care of baby, and just kind of rest. And I would say that that lasted a good year, where I kind of felt I kind of felt bad, and I would try to chip in and do things, but they were always stepping in and just saying, no, go be with baby, or sit down and rest.
Well, I think that's an interesting thought too, bringing your family into it. So not just your partner, but those extended relationships that you have too. I noticed that my friends, when I started having babies, because I had them very young, my friends were not having babies at the same time. And it really kind of created this wedge because they didn't understand what I was going through. They were so sweet and so kind to me, but they just didn't understand. And I just wasn't very fun anymore. And so then you're just kind of floundering. You're trying to find friends and support. And I'm someone who tends to go suck inward when stuff like that happens. Which it's just my personality, but it has some negative aspects to it. And so I tend to push people away. For example, my last son, when he was born, we had some ladies from church who were so sweet and so wonderful, and they wanted to bring us meals every night for 2 weeks. And I just felt so protective of my baby and my body and my house. And like, I don't want people coming in and judging what I look like, what my baby looks like. I want to be in my underwear all day long. I don't want to get dressed. I don't, and so they were so sweet, but I made my husband call them and tell them to stop coming. Even though it would have been nice to have the food. I'm like, maybe just leave it on the doorstep and go. But, and I did. I pushed them away. And I'm sure that hurt their feelings, and it certainly wasn't intended, but it complicates things a bit, because everybody copes differently with those new stresses. And I also see relationship changes with my other children when I had more. My third child was my last one. She was supposed to be, and then we had an oops baby. So we had my third daughter and I had this like bond, this mother baby bond, she was my special one. And then when we had my last child, that changed. And I saw her relationship with me change. And I saw her get really sad and anxious and upset, and she missed mom, So I think that's something that we need to think about too. And again, in our transition planning, prep women for things that might alter. Any more comments on that? Okay. All right, moving on. Number 8, loss of participation in meaningful activities. So we have talked a lot about this. I think that depending on what the occupation is, some are seen as okay. Like, for example, taking care of your health management, going to work if you need to go to work, doing all those responsibilities. If you're going to school, which I was with my second daughter, I went to school 2 weeks after she was born, which was fun. That was lots of fun. But you value these other things that have to be done, and you don't value those things that you need to renew yourself, rejuvenate yourself so you can do those responsibilities. Did you see your guys yourself kind of picking some occupations over others?
When I started having kids, I really stopped, any type of leisure activities for myself. It was very rare. Really just focused on cooking food, cleaning, changing diapers, just the typical motherhood occupations, and just ignored everything else.
Yeah. So those IADLs, right? Like those taking care of the home, taking care of children, taking care of baby. I saw that would take precedence over my ADLs, which would be like taking care of my body, like showering, going to the bathroom, doing all this, doing my hair, washing my face, brushing my teeth. Those things took second fiddle, played second fiddle to the needs of everybody else. Did you experience that, Veronica?
Yeah, I like how you kind of phrased that. It seemed in my own experience that there was a flip in the importance of my ADLs and my IADLs. I think that kind of sums it up right there.
It really does. I remember my mom coming to my house. I don't remember which baby it was, but I think it was like 4 days in, and I had not showered since I got home from the hospital. And in my defense, it was my third daughter. In my defense, the night she got home from the hospital, she got sick. She had a fever, and we had to go back to the hospital, and I had to sleep. I'm a recovering mom, and I had to sleep on the little side bench that they had in the pediatric room. And so there wasn't a lot of support for me there either, which is a real shame. I think that an OT would have been wonderful in that moment. When I was back at the hospital, my life was in crisis. I was in pain. I was trying to recover on this little bench that I'm sleeping on in the hospital, freaking out about my daughter. And I think it would have been really, really sweet if they would have called an OT in to evaluate me at that point. Because it really did. All of my focus was on the health and safety of my daughter rather than myself. And my health and safety matters too. So, all right, moving on. Number 9, feelings that your body no longer belongs to you. We talked a little bit about that, Justina, about those sensory needs. And I noticed that started as soon as I was showing when I was pregnant, that people would come up and they would touch my stomach without asking. And they would feel like they could talk about my body and what it looked like and the shape and if it was correct or not, if I was too fat or too thin or all of those things. And for me, I'm a little shy with strangers, and it made me very uncomfortable. And it also made me very self-conscious about the way I looked. And I had no control over it. I mean, your stomach does what it does. And then that kind of continued on after I had the baby. I remember even breastfeeding, I would have people come up and they would like try to touch the baby's feet or do things. And that was sweet, but it was very uncomfortable to me because I felt very vulnerable. I'm sitting there and I wasn't comfortable with my breast being exposed. And I would have people come and, kind of mess with my baby, mess with my body. And I didn't like it. But yeah, I think that for whatever reason, I think people have good intentions, but when you become pregnant and when you have a baby, not only does your child take over your body, but you also have strangers that kind of invade that as well. Did you ladies experience that?
I'm tall, and so my stomach never got very large, I never looked super pregnant. And so it was just interesting that, they'd be, oh, how far along? Oh, I'm 38 weeks. Oh, are your doctors worried? You're very small, And I'm like, no, they're not. I'm just fine. And just comments where you're like, well, why? But I've noticed even still, like this actually happened during one of my level 2 field works. One of the patients said, do you have any kids? I'm like, oh yeah, I actually have 3 kids. And then immediately it was like, okay for them to comment on my body. And so, you could see looking, oh, you look great for having 3 kids. You've lost your weight or whatever, but it's just funny because I said I have 3 kids, then it's okay socially for them to say something about my physical appearance. And it makes me very uncomfortable. It doesn't seem like that should be acceptable. But
I think that's a really good point. I've had similar comments. People when they find out you have children, they feel like they need to comment on your body one way or another. I think that's an interesting idea. I think that's absolutely on par with what we're talking about. How about you, Veronica?
Yeah, I think I already mentioned, I felt like when I was breastfeeding, like my body was hers, and that, I just, and probably that came from my own self. Like I was okay with giving that to her. And it's so funny that you mentioned about people wanting to touch you. I remember I always had the little breastfeeding cover where it had like a little hoop so I could see baby. And I remember someone coming up to me, take that thing off so we can see the baby, because they wanted to see the baby, even though baby was breastfeeding. They were like, are you sure you're not just hiding her so that we can't get our auntie time? Is she really breastfeeding or is she sleeping under there? And, I think depending on your culture, that could be a little bit off-putting.
And maybe this isn't so much that anyone ever said anything to me about it, but I also, after I had my babies, I went from being like a B cup to like a triple D, just ginormous milk jugs. And I don't know that anyone specifically said anything to me about it, but my sister would comment on things just in a roundabout way, like, oh, your shirt doesn't fit you right, or things like that. She's like, oh, that doesn't look good on you anymore, or something. And I was just like, rude, like I can't control this, you know? So absolutely. All right, moving on to number 10, difficulty completing everyday activities. For me, this probably would have been my number one, honestly. I felt like I couldn't get anything done. I'm a neat freak. I like my space to be clean. I like it to be organized. I get sensory reactions when there's clutter in my environment. Like I can't think straight. It makes me anxious. I'm overwhelmed. And I certainly did not understand my sensory needs at that time. Again, it wasn't until OT school. And I really think it would have been helpful, again, if somebody could help me understand those at that time, but also help me come up with strategies to tackle all the things that need to be done in my life. For example, I discovered a woven wrap. I don't know if you ladies ever did those with my third and fourth child. So I could have this big piece of fabric and tie them onto my body, and then they wouldn't whine because they were close to mom. They could smell mom, and I could do dishes or vacuum or do those sorts of things. But it took me 2 kids to figure that out. How about you ladies? Did you have difficulty completing everyday activities?
I definitely did. I like to be productive and busy, and so I did still get things done, but something that I think would have really helped me is just the concept of prioritizing what I was getting done, because the things that I was getting done, they weren't necessarily making me happier or, my family happier. They was like, it reminds me of like the Eisenhower matrix where it helps you prioritize things and scheduling things and delegating things, and just that concept would have been really helpful to me back then, because like you, I like the house clean and the children need to be fed, but that meant I wasn't getting things done that would have been beneficial for me as a person. So
I think that's an excellent point. I think sometimes moms think that their job is to do everything. And it's still considered your occupation if you're delegating out. So if you get 6 months of a house cleaner, maid to come in, a maid service to come in and clean and help, that's not something that you should be ashamed of. That's you're still delegating the work. You're still in charge of it. And then I also think about ladies that have different ability levels. My sister has ADHD, and she really struggled. She felt like a failure, like she couldn't manage anything. She couldn't keep anything straight. And so, there are a lot of components there. And I love that you bring up the delegation. That I think, again, moms need help understanding that it's okay to delegate, and even a strategy for coming up with how to delegate those things. How about you, Veronica?
Yeah, I agree. I always think of that first year after pregnancy and delivery, I was in so much pain, and then the fatigue and trying to heal my own body. And then I was also working and trying to be mom. And it was a challenge. And like I said, I know my family did help to lessen the burden on me, but that didn't always lessen my need to do and to do things that I wanted to do, that I maybe saw as my routine, my role as a mom, to clean or to tend to the house or cook. Um, and so I think that, those are the challenges that everybody faces, and we all face them differently. And the challenges that we have, vary. I mean, think about women that are stay-at-home moms, like we said earlier, they're home all day, or single moms or single dads, they have that burden all day long, and some of them don't have someone to turn baby over to at 5 o'clock when they get home.
And I think there are, moms that are single that have their babies, and there are moms who have baby in NICU. And so they have that added step of, to go see their baby, they have to find a way to travel there and take that time out to do it, and find childcare for their other children if they have other children. So there are a lot of things that get in the way of getting things done. And I think of like how an occupational therapist might help someone like my sister, for example, who really struggled with a schedule, because she had ADHD. And I think, making a visual schedule for her, actually going through planning stuff out, setting timers on her phone, those strategies that OTs use all of the time when we're working with clients could really help. Even meal planning, before you have baby, have meals already planned, have groceries bought, have those things ready, maybe have a rotation of a month of meal plans, things like that, that just a lot of times we don't think about before we have our child. Okay, so that rounded out the top 10 of what mothers said that they had difficulty with. When we looked at occupational therapists, I had 43 respond to the survey that I gave them. And in addressing the most important roles that they thought they might provide, the top 10 that therapists listed, and I'll just list each of them. Safe infant handling was number 1. Ergonomics training was number 2. Prevention of repetitive use injuries was number 3. Education on infant development and attachment was number 4. Number 5 was breastfeeding support. Number 6 was training on the importance of attachment styles. Number 7 was rehabilitation following a C-section. Number 8 was transition planning. Number 9 was pain relief. Number 10 was information on resuming sexual activity. So there's a lot of things in here that mothers did not cite, but they're very useful. Like going through that, I can definitely see where an OT is absolutely needed, especially moms just having a C-section. I find it interesting that after a good number of surgeries, people get occupational therapy and physical therapy. After having a C-section, they don't. And that's honestly very worrisome to me, because moms aren't just having that surgery and then going home and recouping. They're having that surgery and then trying to care for baby and recover during a very demanding period in their life, where they're having to hold baby and breastfeed baby and all of those things. And so they really do need some strategies to help prevent injury and to promote healing. Veronica, you had a C-section. Can you kind of talk a little bit about what that was like, trying to recover physically, pain relief, making sure that you're keeping your body safe and caring for your child?
Yeah, I think after I had my daughter and I was healing, and then I actually had an infection at the incision site and had to go see a surgeon who released I believe it was an internal stitch that just had to be removed because it was puckering and preventing the skin from fully closing. And then once that was removed, I was able to heal. But, even for myself with a spouse, and having that time to shower and not have to worry about who's watching baby, I still got an infection. And I just think that, there are little things that we can do to help with that. I also had scarring and adhesions from previous abdominal surgeries as well. I'm sure that complicated it, considering that it was not the only time I'd had a cut in that area. And so there are things that we can do. In fact, in my program, I have one part of the program focused on C-section maintenance, because it is an abdominal wound, and then also C-section massage.
Absolutely. I think that's a really interesting thing to look at, is that pain management. And then even for me, perineal care, because I had episiotomies with 3 of them, and then I tore with 1 of them. And so, it was very painful. And some were stitched up better than others. And I really didn't know how to care for my perineal area at that point. They did have some nursing staff come in and briefly kind of give me a peri bottle and say, fill it with warm water, spray off. You can use Tux pads. And that was it. It was a bam, wham, thank you, ma'am. It was like a 5-minute shebang. And I could have benefited from, at least an hour with an occupational therapist going through my ADL routine, including that perineal care. And then also having my first bowel movement after having a baby was very painful. It was probably painful for the first week or 2, and I wasn't really prepared for that. I didn't really have strategies to deal with the pain. And when they give you pain medications, it hurts that even more. It makes you constipated, and it makes it more difficult to have a bowel movement after having the baby. So there are all these things that really it is better to get away from those opioids if we can as new mothers. But at the same time, it's a balancing act of, a lot of times mothers do need them, but even with that, it's not enough. So how do we supplement? How do we give them pain management strategies? And so I think that's wonderful, Veronica, that's a focus and a passion of yours. I really look forward to seeing what you come up with in that area. So just going on to the babies, the focus of my project is on the health of moms. I do understand from reading the literature that the health of moms does translate to health of babies. And so when mom is feeling emotionally supported and psychologically healthy, she is going to be better prepared to engage in attachment with her baby. And as we know, because we're mental health care, we're in the mental health care field, we know that attachment styles with babies really dictates a lot of their life trajectory. And it's related to ACEs, so adverse childhood experiences, and their ability to cope with challenges in their life. And all of those things affect their health through the lifespan. And that's something that we could absolutely help with as well. Educating mothers on attachment styles, and how important it was to have the correct parenting styles authoritative rather than the other ones that are less helpful in parenting. So I'm curious to hear, did any of you guys get any kind of education or training on attachment, baby development at that time? And whether it's in the hospital or even the pediatrician, did you receive that kind of training?
I took a class. I took a class at the hospital where I delivered my baby and got some really basic information with the first delivery, but everything else, all the knowledge I sought out about attachment and parenting and development of an infant, it was mostly like self-led learning, just because that was who I was. I was a mother and I was going to do a good job at it. But I think that can be hard for some people. They might need help, finding that information. For one of my level 1 fieldworks, I was at an inpatient drug rehabilitation facility for women. And there were a lot of mothers there who had just, other issues in their lives that made it to where they didn't have the time or the energy to focus on learning how to be a good parent and how to take care of children and the development of their child. And they definitely needed assistance figuring all that out, So I think every population might not need that kind of guidance, but I definitely think there are some populations that would benefit from it.
How about you, Veronica?
Yeah, I agree with that statement. And I also think, that transition, we're getting that education. I myself took 2 classes leading up to delivery. And I have to tell you, after when you get home and baby's yours and you get there, it's a struggle to remember everything you learned because you don't have sleep. You're healing from giving birth. And there's a lot of change. There's a family, there's a lot of different factors that are impacting you. And I just think, wow, it would have been so nice to have someone just stop by. I mean, look at the value I found in just having a friend who happened to be a lactation expert come to my home. But what if I had an OT come to my home that could have just reminded me, okay, remember we did this in the session and I taught you how to do XYZ, and then having me reteach or show them that I can do it. Because being able to take that education, as we've been learning in our recent classes, and then to extend that learning into actual volition or habituation or of your routines and your norms, and being able to get that functional independence and to actually do what it is that you've learned, they are not always easy to connect. And especially when you have all those external influences, I mean, that can just really impact your memory and your ability to do that. And how valuable if we can create that kind of a health setting where we can actually have that in addition to help a parent, to help a mom when they're first becoming a mom, during that time where they're really needing that assistance. And who wouldn't, benefit from having a couple of extra um, tips and advice to get them through those first few days?
I love that idea. I know that there in other countries they have maternity care workers who do come to the home. And I think that would be a perfect role for an occupational therapist. I even think, in the hospital, having the occupational therapist assist every woman after she gives birth, work with her in her ADLs, talk to her about the basics. And then if it's a new mom or a mom who's identified as someone who might have some particular struggles, whether it's a disability or they're having some emotional problems or they're having more pain than normal, something like that, then also having a house call. I think that is a wonderful idea. And I'm also thinking too about mothers, do they get education on their mental health after they have a baby? I know that with my first child, I shared I had postpartum depression and nobody ever screened me for it. Nobody talked to me about it. It wasn't until months later that I realized that there was something else going on, that I wasn't just a horrible human being who wanted to give up and put my daughter up for adoption. Like there was something happening inside of me. And so I sought care after that, but it wasn't until I identified it. And I think about how many moms just don't identify those issues. Now, as I had more children, I did get screened for postpartum depression. So I know the healthcare industry is getting better. But we also aren't learning about those things like postpartum post-traumatic stress disorder, anxiety, eating disorders are very common after pregnancy with women wanting to get their bodies back. There are a lot of issues that can come up that I think moms just are not educated on. And that kind of brings me to the final point. When I was analyzing the mother's responses to the OT's responses, I found that mothers primarily focused on needing mental health and transition planning, that kind of support, whereas OTs thought moms would need their biomechanical and infant-centered knowledge. So really, as OTs, we can cover it all. But where our value really, really lies, the biggest hole that we have right now is that mental health component. There aren't mental health care professionals that are on the maternity care unit that are typically there. There may be social workers, but they have a different role. And so OTs really could fill that void, that mental health care void that is currently in practice. So any last thoughts, ladies?
Thank you, Elle, for this opportunity. And I think one area that still remains untouched is the value of having OT doing follow-up care with women who have lost their child in labor or in miscarriage.
That's an excellent point. Excellent point. I had several miscarriages and they did a doozy on me. Yeah, that's an excellent point. All right, Justina, you have some thoughts?
You did a great job. I like it. I thought I can't talk. I thought that was really interesting, that just the disconnect between what the parents want and what the OTs think that the parents would need or benefit from, and I do wonder, maybe OTs are thinking, like maybe mothers don't realize what OTs can do. So maybe that's another reason they don't think they would benefit from that. So maybe the true benefit is somewhere in the middle, a little bit of what the OT thinks and what the mother thinks. But it's an interesting topic. I really enjoyed the conversation.
Yes,
I can't wait to see the results, Elle.
Yeah, I'm looking forward to it. And I think that's an excellent point. I agree. I think that it's probably somewhere in between the mothers and the OTs. And I really think that what I got out of this is that mothers need at least, an hour eval after they have a baby by an occupational therapist. And so they can look into each of these areas that we look into whenever we evaluate somebody. So excellent points. And I just want to thank you again so much for participating. Veronica, did you have something that you wanted to say?
I was just going to say, and I think that care, we need to continue it and do a checkup following all the way up to a year postpartum, because, studies show that the risk of suicide in postpartum women, the highest rates are from 9 months to 1 year after giving birth. And I just think that, people are slipping through the cracks, and we can be there to help them find the services they need before it happens to such a horrendous outcome.
Yeah, absolutely. Thank you for pointing that out. And I know, my focus is on postpartum post-traumatic stress disorder, and that takes a couple months to present. So you're right. I think that it needs to be ongoing care. And I would love to see OTs in OBGYN offices too. I think that we would be a wonderful addition there. So, all right, ladies, have a wonderful afternoon. Thank you again. Bye.